Today we'll be demonstrating tracing of basic landmarks on a lateral cephalometry. The first point is you will trace your soft tissue, which is this, and then your hard tissue. The tracing should always be in a single stroke or in a single hand movement, okay? So when you are starting from here, this is your soft tissue. This is your lower lip, and then we trace your chin and your rest of the mandible. So this becomes your soft tissue tracing, which is your outer tracing. Then we start with the hard tissue, which is your various landmarks, one by one. So the first landmark is your nasion point. Nasion point is nothing but the junction of your frontonasal suture. So this becomes your frontonasal cavity. Since it's a suture, you will always have a zigzag line. So this point here where you have your junction becomes your nasion. Okay. Then orbital. Remember what we said? We palpate for the notch. So that notch is at your deepest point, which is somewhere here. Orbital cavity is a C-shaped cavity. Like this and down. Can you all appreciate how it's going down here? So that becomes your point O, which is your orbital. Nasion, orbital. Okay. Next is your sella cavity. Sella cavity will be in this shape generally. Can you notice this shape? Okay. So it's basically like this. Can you see this faint line going here? The anatomic shape will always be this. Okay, sizes vary depending on the individual. The midpoint of the sella turcica cavity is known as your point sella. Okay, then we have our porion, which is supposed to be kidney bean shaped. Very nice. Or crescent moon shape. So your porion. The upper part becomes your P. If at all it is inverted, it can be straight, it can be slanting, it could be depending on individual. The upper part. Okay. Then can you see this? What is this? Condyle. So this becomes, what is this portion, anatomic portion? Posterior border of ramus or ramus. This is your angle of the mandible. This is your body of the mandible. So now let's trace your condyle. Point C, correct? Yes. Midpoint of the head of the condyle becomes your point C, followed by the angle, and then your body of the man. Okay. Then we have, this is known as your pterygomaxillary suture, PTM, which is your PTM. PTM is always marked at 11 o'clock position. Okay. Then this anterior part, can you see? This sharp bony protuberance. This becomes your anterior nasal spine, which is your ANS. Posteriorly it becomes your
posterior nasal spine,
PNS. Okay. Now there will be a cavity-like form joining these two. Okay. This is anatomically, this is how. Can you see this slight bulge coming here?
Yes, ma'am.
This is the anatomical shape. You have to draw it in your anatomical shape. Okay. So what joins your ANS and your PNS, a line would be drawn here. That is your palatal plane, which we'll tell you later. Can you see your incisors here, all of you? Your central incisor. Please draw it how you have learnt it in DADH. Okay, even if you're not able to appreciate it, you have to draw it anatomically in that way. So it becomes your central incisor point. This posteriorly will extend, joining to your central incisor. Anteriorly it will come here, the bone. Okay, basically it's a cavity-like structure. Upper incisor, next we have
lower incisor.
Lower incisors. Okay. Any doubts?
No.
Understood? What will come? What is this region of yours?
Symphysis.
Symphysis. And what is your soft tissue landmark here? Soft tissue we call it as chin or pogonion. Correct. So the most prominent part becomes your pogonion here. And for soft tissue, the resembling part becomes pog dash, which is also known as your chin. Okay. Here we have the deepest point of concavity becomes your point A, which is a skeletal landmark in the maxilla. Point B is your skeletal landmark in the mandible, which is again at the deepest concavity, maxilla and mandible. Okay. Then the line where you have the joining of your lower border of the mandible, inferior border of the mandible, to the symphysis cavity becomes your menton. Very nice. So in between your pogonion and menton we have gnathion. Very nice. So this is your basic tracing of lateral cephalometry.